So I'm going to record. Welcome everyone to our Sex Ed for All panel discussion. Thank you all so much for being here. For anyone who is unfamiliar, this is taking place of our monthly webinar. We typically do a monthly webinar on the second Tuesday of every month, but since it's Sex Ed for All month, we wanted to invite some partners from around the state to join us. So we have Vanessa Tate Finney from AIDS Alabama. We have Charisse Graham from UAB, Andi Lawhead from URGE Alabama, and Chance Shaw from AIDS Alabama South. So thank you all so much for being here. I'm going to, there we go, just switch my questions over to another page. So I would love for you all to introduce yourselves, even though I just said your names, but introduce yourselves, tell us where you work, and just talk about what your organization does, especially as it relates to advancing comprehensive sex ed in Alabama. And Vanessa, you're like the person right next to me, so we'll just start with you.
Sure. Thanks, Christina. Thanks for inviting me on this panel today. As Christina said, my name is Vanessa Tate Finney. I use she, her pronouns. I'm the Director of Policy and Advocacy for AIDS Alabama, and I'm located in Birmingham. And I'll go ahead and toss it over to Dr. Charisse Graham, since you're right next to me.
Hey, good afternoon. I'm Dr. Charisse Graham. I am one of the adolescent medicine physicians over at the Adolescent Health Center associated with Children's of Alabama, so here in Birmingham. And as far as, what we're doing with sexual health, basically we see patients from ages 11 to 22. And so we provide medical care for those patients for a wide range of adolescent issues, from mental health, general medical care, and then including sexual and reproductive health as well. And then I will pass it off to Andi.
Hey y'all, my name's Andi Lawhead. My pronouns are they, them, or he, him. I'm a field organizer with URGE, Unite for Reproductive and Gender Equity. We're a youth-focused reproductive justice organization working on the ground in Alabama, Georgia, Ohio, Kansas, and California. Our primary mission is kind of uplifting and centering the leadership of young people, especially young people of color, queer and trans folks, people of low income. And for the past several years, our work on the sex ed bill has been in coalition with other organizations like Alabama Campaign and AIDS Alabama.
Awesome. If Chance, if you would just want to wrap up our introductions.
Absolutely. My name is Chance Shaw. I use they, them, or he, him pronouns. I am the Ending the HIV Epidemic Coordinator at AIDS Alabama South, the clinical coordinator for our clinic, Shell Health Services, and then the coordinator for our program for teens, Teen Advocates for Risk Prevention. That's kind of where our focus is today on my work. We do stigmatized education education on stigmatized topics for teens, like sex ed, queer sex ed, abortion, drug use and abuse, those types of things.
Awesome. Thank you all so much for being here. Your expertise, I think, is going to lead to a really great discussion. So for all of you, for any of you who want to answer, let's just start off. What is sex ed, and what does sex ed for all mean for you in the work that you do? So anyone can kick us off.
Well, I can start. So for me, in my profession and in my clinic, sex education basically means, for me, informing my patients about their bodies and how it works, how it operates. A lot of my patients come in with concerns about, reproductive ability, and sometimes they're not even thinking about the act of sex itself. So that's where we start. And in terms of, sex education for all, I do it from a perspective of both the patient and the parent. And for those who are not having sex and those who are having sex. So I just let everybody know that, coming to me is a safe place that you can come to talk and have those conversations, at whatever point you are in your life. So the ones that aren't having sex, I tell them that in the event that you do decide to become sexually active, this is where you come. We can have these conversations. You know, do you know how to protect yourself in the event that you decide to engage? And I start there. And then once they are having sex, you know, then we move into, you know, okay, let's do, you know, the hard work and have the hard conversations in terms of what do you need to be doing at this point to protect yourself from babies, from infection, you know, if you are interested in those things. And then for parents, from a parent perspective, I always encourage the patients and the parents to have those conversations amongst themselves, because sometimes it can be awkward. And I let them know that I'm happy to be a mediator, but they need to be having, you know, those conversations at home, so that, you know, everybody is, you know, in the loop and, you know, doing what they can, you know, when they're not with me. And we do a lot of work around, you know, reproductive health, so contraception, you know, not only just condoms, but, you know, birth control. And so I do a lot of that on a day-to-day basis.
Awesome. Thank you, Charisse. Who else? What is sex ed and what does it mean for you and for the work that you do?
So for us with TARP specifically, sex ed is anything involving sexual reproduction or someone's sexual organs, anything that they may be using those for, anything like that. And sex ed for all for us really means making sure that each person who gets sex ed from us gets it in a manner that is relevant to them. So not just your standard, you know, a lot of times when we think about sex ed, we think about learning about penis and vagina intercourse in a way that's geared towards reproduction. And that's not relevant for a lot of people. So we make sure that they're learning about other ways that sex can be had, not in a way to encourage, but in a way to inform. This is what can be done. And these are the ways to stay safe and protect yourself through that as well.
Awesome. Thanks, Chance. Anybody else want to answer that question?
Yeah, so I just want to tag on to what both Chance and Dr. Graham have said. I'm also a co-coordinator with Chance for the Teen Advocates for Risk Prevention group. And so our focus is definitely on educating individuals, regardless of their level of knowledge of sex ed already, is ensuring that they are educated in an age-appropriate way, and is culturally and culturally inclusive and comprehensive in topics. Taking a more 10,000 foot view, you know, we do have updated standards in the state. We did pass a new sex ed law last year that updated the standards and removed the homophobic language that was written into the bill. So one of the things, though, that may be a negative consequence of that is that schools don't have access to sex education that meets those standards, or they may not be willing to teach sex education that meets those standards. And so one of the things that we accomplish through TARP is ensuring that students have access to that comprehensive information, whether or not they're receiving it through school.
And sorry, Chance, you said this and I meant to ask you, but Vanessa or Chance, can you just tell us what TARP stands for?
TARP stands for Teen Advocates for Risk Prevention. It's TARP. And as we've talked about that, it's a monthly program where we usually meet 2 times a month virtually on Zoom. We promote the meetings on Instagram and they're opt-in, meaning the teens can join if they want. And we cover different topics every month. Throughout the year, as I said, we've done things like reproduction, a meeting about menstruation in the uterus, queer sex ed. We did a panel on sexuality and gender identity. And this month, we're actually doing 2 panels in conjunction with the Trevor Project on teen mental health.
Awesome. Thank you so much for sharing that. And I've had the pleasure of speaking with those young people also. I know it's a great program that y'all are running. Okay, and I just want to make sure, did anybody else want to say anything else about sex ed for all? I do have just a quick follow-up because Vanessa mentioned this. but comprehensive. So that's something that the Alabama campaign is getting into. I work in this space. I know what that word means in relation to sex ed, but can one of you just share with us, what does that mean in the work that y'all are doing? What does comprehensive sex ed look like?
I'll jump in for a little bit. For my standpoint, like comprehensive sex ed really starts at like a young age, but it's age appropriate. I think we might touch on this later, but I know that one kind of opposition talking point has been, oh, they're trying to teach like kindergartners about condoms, which, you know, we hear, no, that isn't true. It's really about like teaching young kindergartners, like, hey, if somebody's touching your genitals, go talk to a trusted adult. So starting from a young age, that's really age appropriate and includes things not just about condoms, contraceptives, but also like healthy relationships, like your relationship with your body, stuff like mental health.
Yeah, that's awesome. And yeah, that's what it means for us as well. That's what we advocate for, is age appropriate sexual health education, but certainly sexual health education is so much more than just sexual intercourse. You know, it's so much more than that, and so much more than prevention as well. So all right, so let's move on to Vanessa. I would love for you to answer this next question. Anybody can join in, but this is really geared towards Vanessa's expertise. Could you talk about the current policy landscape for adolescents and sexual and reproductive health? And in particular, you mentioned the newly revised sex education law, but in particular talk about that, and then also some of the anti-trans legislation that we're unfortunately seeing in Alabama.
Sure. So I'll start with what the landscape currently looks like. So Alabama is not required to teach sex ed in schools, and so therefore it's an opt-in for students. And you know, kind of the difference between opt-in and opt-out. Opt-in means that parents have to opt their children into sex ed a curriculum, whereas opt-out means that children are automatically going to be taught sex ed unless their parents opt them out of that sex education. But unfortunately, it's not required in the state of Alabama. Now, there are certain standards such as teaching you know, about STIs such as HIV, gonorrhea, things like that. Those are required as part of health classes, but they're not necessarily tied to comprehensive sexual education. And so there's a huge component of like that social emotional learning where you learn about healthy relationships and things like that. It's totally disassociated from those concepts. So it's not comprehensive at all. Where the new law comes in is that it does now require that if you're going to be teaching sex ed, that it be comprehensive, it be inclusive, culturally appropriate, age appropriate, as Andi mentioned. And so the new law requires that all of those components are part of sexual education. But like I mentioned, you know, there are a lot of barriers to teaching sexual education, especially in a state like Alabama, whether it's, you know, people's perceptions of what sexual education really is, or the funding levels that we have in our schools, whether or not they're able to afford to bring in sexual educators. There are quite a few barriers. As far as the anti-trans legislation, there is a little bit of moving parts going on with that right now. So there were 3 major pieces of anti-trans legislation that were passed on the very last day of legislative session this year. The one that's getting the most press is the ban on gender affirming medical care. That one is currently being litigated in the courts. It did take effect on Sunday. However, the judge who heard the case for a temporary injunction, I'm sorry if this is a little bit legalese, but a temporary injunction would mean that the law would stop being in effect. We're waiting for the judge to decide whether or not to put a stop to the law until it can work its way through the court system. So this is going to be a long slog on fighting back on this particular bill. There are two other bills. There is the bathroom bill, which has been repealed in several other states when it's wound its way up the courts. There's not currently any legal pushback to that particular law as of yet, but stay tuned. I imagine there will be at some point. And then attached to that bathroom bill was a mimicking of Florida's Don't Say Gay bill, only it goes further than Florida. In Florida, it's only kindergarten through third grade, where it's the Don't Say Gay bill. In Alabama, it's kindergarten through fifth grade. So I imagine that, in the conversations around divisive concepts and all of that, we may see some pushback on that particular law as well. But I would definitely see what other states are doing. I don't think Alabama is going to be the first one to challenge that particular part of the law.
Awesome. Thank you for that. And yeah, there's a little bit of legalese in there, but I think it's important for folks to know sort of where we are in our state and where those pieces of legislation are in the legal process as well. So really fingers crossed that the courts will see it fit to not allow that. In particular, the anti-trans bill that doesn't allow for gender affirming care. Hopefully they will see it fit to not allow that to continue. Okay, so we're going to shift gears just a little bit. So Andi, I know you and I worked together for many, many years because you started out as a young adult advocating for inclusive sex ed. So can you share what that experience was like and why it was so important to you? And obviously you have stayed in this work as an adult. So I just am curious to hear your take on that.
Yeah, for sure. So I think my experience is maybe different from some others that I work with because I didn't grow up in Alabama. I didn't go to high school, elementary school in Alabama. I grew up in Indiana and came down to UA for undergrad, and that's kind of where I got my start as an organizer. So a lot of my early experience was advocating for sex ed to like elected officials, doing some lobbying work, mobilizing others to do so as well to get support on this bill and for it to eventually pass. And it was important to me not only because like the bill itself is important and getting comprehensive sex ed is an important issue to me, but really like in those community spaces within the like advocacy organizations that I joined, they were really like the first time I was able to fully show up as my whole self. I was closeted growing up, and finally found like that sense of community as a queer and trans young person.
Yeah, that's really awesome and so important for all young people to have those safe spaces. So I'm so glad that you were able to find that even though it was later in life. And we're so glad to have you working on sex ed and other reproductive justice issues in Alabama. Chance, so you work with young people and through the Teen Advocates for Risk Prevention, TARP, we talked about that. So how are the young people that you work with viewing sex ed? What are they talking about? What do they want to know? What are they missing out on in school or at home? I'm just so curious to know what you're hearing from the young people.
So from what we hear and what we see, young people want comprehensive sex ed. It's something that they realize that they're not getting. It's something that's being hidden from them. And so when we have meetings on topics relating to sex ed, those are some of our best attended meetings. We've had, on the one on menstruation and the uterus, which covered some reproductive health. That was our best attended meeting with over 100 participants, which for us, when we average 30 to 40 a meeting, that's a lot. Same thing with our panels on like queer sex ed, on sexuality, things like that. Those were all panels that got, or meetings that got, up to 60, 70, 80 participants in those meetings. So it's something that they definitely want, and they want to know more as well. A lot of them may have gotten, your basic, this is how, cis-het sex works, but that's all they got. They didn't get how sex ed is relevant for them, the things they need to know. And so we see repeatedly that they'll want to know, how different aspects of sex work, the things that they're not told about and talked about, things like queer sex ed, different aspects of that, how oral sex works and the risks behind oral sex versus penetrative, either vaginal or anal sex. So we're seeing they want to know everything. And that's really the best thing about it, is they're open to learning everything they can about it. And it really bodes well for our up and coming generations that they're seeking out this knowledge as well.
Yeah, and I mean, knowledge is so important, that they know how their bodies work, that they know how their sexuality can work and can look. We see that, parsed out in the research over and over again, that, this knowledge is so critical, and it actually can lead to decreases in some of the sexual risk behaviors that we see, when we look at sexual health programs. So, Charisse, I know you talked about this a little bit already, but what is it like? Maybe you can give us more of a sense of what it's like to have those conversations with the adolescents in your clinic, and what kind of sex ed is happening, maybe even just beyond the traditional, this is how reproduction works, within the clinic. What does that look like?
Yeah, so it depends on what the patient is coming to me for. And I agree with Chance wholeheartedly in terms of, patients are wanting this information. We've had talks with our youth advisory board, and they're asking, for us to have these conversations with their peers so that they can go back and share the information. When patients are coming to me, looking for help with menses, a lot of times, we're talking about, they're coming in, they're not knowing that they're not supposed to be bleeding as long as they've been bleeding for. And so we're having those conversations. So I'm educating them on, you're a woman. This is, these are the parts that you have. This is how it works. This is what's happening. This is normal. This is not normal. And then, when they're coming to me for contraception, we're going through all of their options for contraception, from pills, patches, rings, implants, everything. I'm giving them the full gamut of what is out there and available for them. If they're coming to me trying to confirm a pregnancy, I'm talking to them about what their options are. We're doing options counseling for that. We are talking about, how to, what testing I need to do in terms of sexually transmitted infection, because now you're pregnant. So I need to know if you also have an infection. I can't tell you how many times I've confirmed or a person's tested positive for a sexually transmitted infection, and I call them and I let them know, and they ask me, how did I get this infection? Because they're not being taught that when you have sex, you are at risk for acquiring a sexually transmitted infection. And so I'm having those hard conversations, like saying, hey, you got this infection from sex. You got this infection from the person that you're having sex with. You need to go and talk to the people that you're having sex with. And then, when I have patients who, are open with me about being sexually active, I'm asking them, what body parts are you using to have sex? Because I need to make sure that we're testing all of those parts that you're using for sex. because there are countless times where patients come to me and they say, oh, I've already been tested. And I'm like, well, what was tested? Oh, I don't know. Okay, well, have you been tested for HIV? Have you been tested for syphilis? Like, are you just leaving a urine sample? Oh yeah, that's all they did. Well, you didn't get blood work, so I don't know that if you have, HIV or syphilis. Or, they're saying, well, I'm also having this types of sex. And I'm like, well, you need some more testing so that we can make sure that you don't have other, infections. And so there are times where a patient tells me, oh, I've already been tested, I was negative, and then I go and I do the additional testing that they need, and they come back positive. So it's a lot of education on, what the risks are, what the treatments are, what your options are. And it's a lot to take in at times for these patients because they are very ill-equipped at times.
Yeah, and one thing you said that kind of stuck out to me was they have a lack of knowledge that engaging in sexual behaviors could lead to an infection, but they also, that made me think, well, they also have a lack of knowledge on how to protect themselves as well from those. So, it's not all about the engaging in the activity. It's also about how do I protect myself when I engage in these activities. And that's definitely where we see a failing on the part of sex ed, because people aren't talking about condoms or contraception, but condoms being the one that could prevent an infection. Okay, so I just want to talk a little bit, and I think I sent this report to all of you. I'm going to actually go ahead and drop it in the chat as well. But SECUS, which is their new tagline is Sex Ed for Social Change, but they've been around for a really long time. They just released a new report called The Truth About Attacks on Our Kids, Schools, and Diversity. Okay, I need to just drop this in the chat real quick before I forget. So anybody can click on that link and read it. So but the report identifies what they call the regressive minority, and they are those people who staunchly oppose comprehensive sex ed, inclusive LGBTQ programs, access to diverse books, and they oppose teaching about racism and white supremacy. And we see the regressive minority showing up at school board meetings, often under the guise of being parental rights groups or wanting school transparency. But in reality, what we know and what this report identifies is these groups seek to keep critical information away from their students, or away from really any student who does not fall into white, cisgender, heterosexual sort of identities. So this question goes back to Charisse. Because we see a lot of push from the regressive minority for abstinence-only education among young people, can you tell us why, as a medical provider, why abstinence-only education is not helpful?
Well, it's not helpful because we've seen in studies that it doesn't work. It doesn't prevent pregnancies. It doesn't prevent infections. Really, the thing that's going to prevent those risk behaviors is teaching about the risk behaviors themselves. And so in addition to that, it's harmful because, it's lacking that comprehensive education that is needed, right? And so, when patients come in and they're like, I know how to not have babies, I'm going to use a condom. And I'm like, sure, like, yeah, you can protect yourself with a condom, but there are other things that you can do in addition to that. And the other piece of that is that in order for anything to be effective, you have to use it properly. So not having that piece of education is also harmful because, patients are doing things like using, 2 condoms at one time, or using whatever they can find, like saran wrap or plastic bags, things of that nature. And those things are not effective. And so they're still placing themselves at risk unbeknownstly because they don't have the proper education. So when we're, telling our kids that, oh, if you have sex, you're going to have a baby, yes, if you don't have sex, you're not going to be at risk for those things, sure. But when you skip the part of when you do decide to engage, this is what you need to do, then you just leave them, off to their own devices. And so that's how we end up with the unexpected pregnancies and the unexpected infections. And so then, as opposed to doing prevention or primary prevention, now we're doing risk reduction and, doing treatment.
Yeah, at the campaign, we always talk about abstinence as being a tool in the toolbox. Of course, we can all, agree to not have sex in a classroom setting or whatever, but then real life hits, and at some point you're going to engage in sexual activity, and it doesn't matter if it's on your wedding night or and you're in high school. You need to know how to protect yourself, and so that's what we always try to emphasize for folks, because abstinence is emphasized within the sex education law, and so schools are required to emphasize abstinence if they're talking about sex. And I think you can still talk about, sure, abstinence is a great option. If that's important to you, you should certainly practice it. Here's some tools for negotiating that within your relationships, but also here's this other information that will be critical to you at some point. And then, giving that information to them over and over and over again until they have cause to use it, so that they know how to use it when they need to use it. Okay, so Chance, HIV prevention is obviously a critical piece of sex ed. And we know that young people are disproportionately affected by HIV, especially in Alabama. And Alabama actually requires HIV prevention education starting in 5th grade, going through 12th. However, we still see very high infection rates. So in your work, in your experience, what is the cause behind these high rates, despite the education that they are supposedly receiving about HIV?
So I think there's a couple of aspects of why those rates are so high. And one is, for years and years, until last year, as Vanessa mentioned, when they updated the sex ed law, we still pushed things like abstinence is the way to prevent these and that type of thing, as well as talking about homosexuality in derogatory terms and things like that. So in a lot of instances, I think when they start teaching about abstinence only ways of preventing STIs and HIV, or that homosexuality is stigmatized, that type of thing, these students will tune out. That's, if you start telling me that being gay is wrong, I'm not going to listen to you either. And it doesn't matter if you gave me the winning lottery numbers after that, I wouldn't hear them. Another is, we don't have at this moment a comprehensive curriculum statewide for teaching HIV prevention. And that's something that we are working on in the EHE initiative. But until we get that ready, it's really up to each teacher on what they teach as far as HIV prevention. And in some areas, they may get a great teacher who is knowledgeable and passionate about topics and get everything they need. But the reality is, in Alabama, in a lot of areas, they're going to get the absolute bare minimum required by law. And that's not a lot. The law itself almost covers what the bare minimum is written in it. So without that comprehensive statewide curriculum that covers the ways to contract and the ways to prevent HIV, we're still going to see higher rates than we'd like while we get this curriculum out statewide.
Yeah, thanks for talking about that. And yeah, local control is huge in Alabama. And I mean, it varies not even by school district, by school to school. Like, you can have 2 high schools in the same district that could have totally different sex ed going on, totally different information about HIV education. So yeah, thanks for pointing that out and for talking about the reasons why we might still be seeing, or why we are still seeing such high HIV rates. Vanessa, so I would just want to know, what attacks are you seeing on sex ed from a policy perspective on the school level? And then are you seeing or hearing about these regressive policies taking place in schools? So, I'm curious to see how sex ed is being attacked on the big policy level, but also on the school level, if you have that experience.
So first of all, I absolutely love this report. It is really comprehensive and thorough and covers a lot of topics. And one of the topics that it touches on that I think that we've seen right here in Alabama has been the argument of parental rights, more parental control over what's happening in the classroom. We've seen school board meetings go awry, if you will. I don't know that any of ours have made national news, thankfully, but there's still a lot of contention going on in these school board meetings as parents are trying to assert what they believe to be, their rights with their children in the classroom. So I think we're seeing it on a local level, these attacks towards anything that is considered progressive at all, and comprehensive sex education has been labeled progressive, even though it should be a basic foundational element of education within the school curriculum. But on a larger policy level, as Chance was saying, and I said earlier, there is no statewide curriculum for inclusive, comprehensive sex ed. And so it isn't necessarily a policy attack, more as just the absence of being able to comply with the policy, because the curriculum just isn't there. And so you do have this wide variation, from school to school, not even school district to school district, as you were saying, but even just school to school, on how comprehensive their sex education is going to be, given, what materials the teachers might have, who's providing those materials, are they having to come up with them on their own? Are they being provided by an outside source? A lot of these outside sources will offer to provide, sex ed curriculum for free. However, that's usually abstinence only based information. And, if that's what schools can afford, that's what schools can afford. And so they go with these free based options that are not in compliance with, what the law is as of now. But, there's really little enforcement of, complying with the law.
Right. So for anybody that doesn't know, because it's not mandated and there's no curriculum, there's no enforcement. Because that would require money to have somebody who's making sure that the curriculum that is non-existent is being complied with, and the state doesn't have that money written into the budget. Department of Ed doesn't have that money, and so it just often gets overlooked. And we just hear anecdotally what's going on in individual schools, because as much as we try to figure out what's going on in each school district or each individual school, a lot of times schools are hesitant to tell us because they don't want to get in trouble, or they're not complying, or maybe they're doing something where they are bringing in a third party. Sometimes those third parties will be religiously affiliated, and so that will slip into the schools as well, where we're supposed to have a separation of church and state. So a lot of things happening with the Alabama sex ed landscape. So Andi, I just want to talk, I'm going to switch topics a little bit, but it's still reproductive justice. The Alabama campaign does not typically talk about abortion, but I don't think any of us is blind to the fact that Roe v. Wade is almost certainly going to be overturned next month by the Supreme Court. It's all over the news. What I'm curious to hear from you about is, how might that eventually affect contraception and sex ed, as you see it in the work that you do?
For sure. And Vanessa, definitely jump in if you've got more legal stuff on this than I do. But yeah, a lot of Roe rests on like the right to privacy, and some things that also come from the right to privacy were like Lawrence v. Texas, gay marriage, etc. And like we're already saying, like there are anti-trans bills being passed in Alabama and other states. So definitely when Roe is overturned, like contraceptive, sex ed, queer and trans folks will just continue to be under attack.
Right, because my understanding is that they started, and again, Vanessa, just jump in here, but they started the initial things that eventually led to Roe v. Wade were getting contraceptive access for married women and then for single women, and then so that these rights to privacy sort of built upon one another. And by turning back Roe, we could potentially see a turn back. And there are already state legislatures that are trying to limit some forms of contraception. So it's not a crazy thought, you know, because I just have seen IUDs and Plan B in particular are coming under attack already.
Right. And I mean, this isn't the first time we've seen attacks on contraception. You know, the Hobby Lobby case several years ago was, you know, fighting against the Affordable Care Act on having to provide no cost contraception to their employees. And so there is, you know, Supreme Court precedent that, you know, lays out an argument for, you know, for individuals to not have the right to access contraception. And so I definitely see Roe, the fall of Roe definitely has a lot of impact down the line. I think that we will start seeing attacks, sex, you know, based attacks, to use the constitutional language, you know, of equal protection under the law. You know, sex-based discrimination is illegal, but now we're seeing that, you know, if it's not codified into the Constitution and it's only codified into law, we're seeing those rights be overturned in individual states, and now, you know, nationwide as we see Roe fall. So I think that Andi is absolutely right that this is going to be a cascade of rights that we are at risk of losing. And I think that we need to be very cognizant that this is much larger than just losing the right to access abortion. That, you know, things like gay marriage may be under fire. You know, all of these anti-trans laws that are sweeping across the country may have a, you know, more bolstered argument if, you know, the Roe opinion comes out the way that it's currently drafted. So I do think that there's a real risk of seeing some really disastrous effects from the fallout of turning over Roe v. Wade.
Thanks for sharing that. Okay. Oh, go ahead, Chance.
I want to chime in on that, kind of to bolster the that we are already seeing attacks against things like birth control. There is a Republican candidate in Arizona that is actually campaigning on pushing for Griswold to be overturned, which, for those unfamiliar, Griswold overturned a state ban on birth control in 1965. And overturning Griswold would essentially pave the way to even ban contraceptives like condoms, which, I mean, that points us in the dark ages. Yeah,
it's really terrifying to think about the cascade, the unintended consequences, maybe by some, and totally intended by others. So it is scary to think about, but all the more reason for us to be vigilant. And that kind of gets to my next question. And this is for any of you, for all of you. The work that you're doing includes a lot of advocacy work. I mean, we're advocating even on this panel. How can folks be advocates for comprehensive sex ed for all Alabamians? I guess the real question is, how can people be advocates for this issue?
I'll go ahead and start. Number one, I would say, is contacting your legislators. It may seem like a scary thing to do, but chances are when you pick up the phone, you're going to be speaking to a low-paid staffer who's going to take down your name, your phone number, and your message, and will give it to your legislator. I highly recommend practicing doing so, writing a personalized letter. Often you can sign on to letters. I know URGE is really, really great about putting out these calls to actions to sign on to, but it's really important that you personalize those messages so that they stand out from what the framework language is. But definitely contacting your legislators, picking up the phone and making that phone call and telling them that comprehensive sex education is important to you as a constituent, as a parent, as whatever your role is, even just a community member, knowing that, if legislators often tell me that if they receive 5 calls about something, that's significant. So it really, politics is so on the local level. And, we're seeing that with Roe, that politics is on the local level. And so contacting your legislators, telling them what it is that you find to be important, and, really voicing your opinions and, expressing your belief with your legislators really does go a long way. They do get those messages, they do hear them, they may not agree with you, but you may get a phone call or an email back that at least says like, hey, thanks for reaching out to our office. I totally don't agree with you, but I really appreciate you taking the time to reach out. But that makes a difference, because if enough people do it, then there is, then they're starting to see their constituency believes a certain thing and believes a certain way. And if, sex is important to you, it's important to reach out to your legislators to let them know that comprehensive sex ed and actually like meeting the requirements of this new law is something that is important.
Absolutely. Yeah. And I always find it infuriating when they disagree with me. And I'm like, oh, I didn't want this letter with you telling me why you believe what you believe, but it is important. That's what democracy is all about. So
exactly.
Thank goodness for that. But yeah, it is, it can be frustrating, but it is important. Does anybody else want to answer the question about how we can be advocates, especially for comprehensive sex ed, but really for any of the things we've talked about on this call today?
So I'd say a big way is to find local organizations to get involved with as well. In every city, in every town, and I know definitely in Alabama, there's different organizations that are advocating for different groups. Here in Mobile, we've got quite a few. I know there's plenty in Birmingham, Huntsville, Montgomery, and find those organizations and find out how you can help. And if they don't necessarily have a way that you feel like you could fit in to help, ask if you can make that way with them. A lot of organizations, if you say, hey, I'd like to join you and help push for this, if it aligns with their organization's mission, then they'll be all for it. So always reach out, find what's in your area. Like Vanessa said, that it really starts on the local level, and get involved with your community in that way.
Yeah, that was going to be one of the ones I said for sure, is to getting involved with your local community organizations. And I would even say being on calls like this and just educating yourself and sharing those resources with your network. So if that looks like sending an email to your colleagues or posting something on Facebook or Instagram, sometimes people don't think that those things make a difference, but I have seen them make a difference in just continuing that dialogue. Julie, I think you have your hand up. Did you want to say something? Come off mute.
Yes, thank you.
Awesome. Yeah.
I'm the minister at the Unitarian Universalist Church of Birmingham, and for those of you who don't know about our organization, we are mostly a bunch of atheists, but we do allow stragglers to be a part of us. I keep hearing over and over that you don't have curriculum, And I just want to point out that years ago, the United Church of Christ and the Unitarians got together and wrote a comprehensive sex curriculum that we update regularly. It is all of the things. I looked briefly through the packet that you posted. It's all of the things that you want. It's inclusive of LGBTQ folks. It's trauma informed. It's all about consent. It is not abstinence based. So, and the piece about, because there are some things about our values, both from both denominations, but those are separate books. They're not a part of the actual meat of the curriculum. So I'd really invite, let's talk about how to get you all this curriculum to look at, because it's a great place to start from. There's no sense in reinventing the wheel when it's already here and it's already done and it's just a matter of promoting it. And I'm a certified teacher of the curriculum, so I can speak very informed about it. It's a great curriculum. I've done it with kindergartners, high school, middle school, all kinds of groups, and it's age appropriate and all the things that you've been talking about and are looking for. So I just want to work together and not recreate the wheel if we don't have to.
Yes, our whole lives. I have also facilitated that program and went to a training like 10 years ago, but have facilitated with high schoolers, and it is a great, comprehensive, truly comprehensive sex ed program. So just a really great resource. Thanks for bringing that up. And it looks like Vanessa would like to connect with you offline. So invite you to do that. As we just kind of wrap up here, we have about 5 minutes left. I just would like for all of our panelists to just take a minute, tell us where, share any final thoughts, and then just tell us where we can find you online. Or you can share your email, share your socials, whatever works for you. I'm going to ask Andi, will you kick us off?
Yeah, for sure. I just dropped my email in the chat. It's just alawhead@urge.org. Find us on Twitter, urge_AL, I think. Instagram, urge_AL_org, maybe. Not great at social media, y'all. You can also follow the main Urge accounts. Check us out on urge.org, and it links to everything else.
Awesome, thanks. Chance and Vanessa, well, I know you two are different organizations, but if you just want to share for both of you.
Sure. So AIDS Alabama, we actually have two different websites. So it's aidsalabama.org or aidsalabama.south.org, depending on if you're in the Birmingham area or the Mobile area. And then if you wanted to follow TARP online, it's on Instagram, Teen Advocates for Risk Prevention, and 4 is with the number 4 for those of you who are watching on Facebook. But if you search for Teen Advocates for Risk Prevention on Instagram, it'll come up immediately. And also you can follow AIDS Alabama on Instagram and on Twitter. And if you wanted to follow me on Twitter, I'm at Vanessa Tate Finney. So those are all of our social media handles.
Awesome. And just want to share, Kelly Ross Davis is here from UAB's 1917 clinics. Thanks for being here, Kelly. And you can look them up online as well. They are serving folks who are HIV positive in the Birmingham area, but maybe also statewide. Kelly, I'll let you speak to that.
Yeah, sure. So good to see some of you that I already know and to meet some others. And yeah, our clinic mainly serves people in Jefferson County and the surrounding counties, but certainly we have people that travel from various parts of the state. And we connect well with our community partners like AIDS Alabama. So good collaboration. I just can't say enough about how important this work is. I started a program about 20 years ago, more based for college students that were coming into college with nothing and parents that hadn't talked to them, schools that hadn't talked to them. And it's still kind of the reality. And that was for everybody, let alone trying to be inclusive and trauma informed and all the things that we've made improvements on. So we've come a long way and we seem to have a long way to go. And I'm just really hoping we can do everything we can not to go backwards like it seems is happening. It's very disheartening. So keep up the good work. I think it's really important that we support each other, especially during these really extra hard times it seems like right now. I was just rereading UAB's medicine statement that came out about once the law went into effect on Sunday and sort of how that affects what people are having to do at UAB. One thing I guess was positive is counselors can keep doing the work they're doing. And if someone got a prescription before the law went into effect, that they can still get that filled at a pharmacy. Just a tiny bit of positive for right now, and hopefully things can get overturned.
Thanks, Kelly. And Dr. Graham, I just wanted to, I saw you dropped your email, but is there any closing words that you wanted to share with us as well?
I mean, I just want to thank you for, having me on this panel. I think it's so important to have these conversations and, to provide this education. Like I said, it's so many times that I have patients come in who have little to nothing as far as education regarding this topic. And so, thank you all for doing this work. As far as like Children's of Alabama, they have, Facebook and Instagram pages. So those are resources. I am on Instagram and Twitter as well at being Dr. Mommy, being Dr. Mommy. That's how you can find me. So yeah, and there's lots of, I know we have a lot of local organizations, but there's lots of like national organizations that you could definitely collaborate to help assist you with this work too.
Yes, absolutely. Thank you, Dr. Graham. And thank you all to all of our panelists. Some of you joined us as a panelist at the last minute, so especially thank you, Charisse and Chance. But thanks everyone. And this recording, I'll send out an email so that everyone has access to it, and we'll share it on our website as well. Thanks everyone for being here, and we'll just close out. Have a good rest of your week.
Thank you.
Bye, everyone.